You're a nurse. What have you developed in order to ensure that everything is charted correctly?
So these are the five things that you shouldn't do when charting. Don't be vague, don't be negative, stating opinions versus facts, being incomplete in your charting, and waiting to the end of your shift. Being vague, just writing something very generalized for the patient is not individualized care. And as we know, patients are different and everyone needs individualized care. So be specific. What did you do? How much water did you give them? How did they take the water? How did they tolerate the water? Be very specific when you're charting something. Being negative, you never want to put anybody else down. You never want to say you walked into the room and the patient looked
Mhm.
like a mess. The nurse before you left her in a terrible condition. But on the flip side, you can say all the positive things that you did. You changed all her sheets. You gave her a full bed bath. You made her comfortable. You gave her an extra pillow. All of those positive things that you did, that's what you want to put in there. Don't try and be negative about the person before you. Stating
That's something that I
opinion.
do now. I'm sorry to cut you off. That's something I also do now as more of a seasoned nurse. Anytime the patient is bathed or changed in any capacity, especially since skin breakdown is so important, I always make sure I get it in there, whether I do it or the nursing assistant. That's just, again, that's something that can come back and get me later. So I always make sure it's done.
Yes, we do so much throughout our shifts that we don't write down, that we don't take credit for. Bed baths, walking patients to the bathroom, walking them in the hallway, giving them water or food, answering their loved one's questions, reaching out to a loved one when they ask us to. There's so many little things that we do throughout the day, and those things just don't get charted. But the good thing about it, you can put whatever you want in the chart. The chart is for the nurse to be able to chart what she did. So put it in there. That's what it's for. But people think that those are just so in unimportant that, I'm not going to put that I went in and checked on them sleeping and they were still breathing. That could be a really important piece of the puzzle if that patient is not breathing 15 minutes later. You want it to say, I checked, did my hourly rounding, checked on the patient breathing evenly and unlabored. Those little things that you don't think is important actually can be important, especially if it came to a legal suit.